Hi you guys, welcome back to my channel, and if you are new here then hi and welcome. My name is Arielle and I make videos all about motherhood and lifestyle. So if you enjoy watching that kind of content, I would love for you to be a part of my YouTube family. So hit that red subscribe button and the notification bell so that you get notified every week that I upload new content. So in today's video, I thought I would sit down and explain to you guys what the C-section recovery looks like from the time that you get back into your room after the C-section through up to the 6 to 8 week mark where you're going to be almost in full recovery. Now, I just want to throw this out there that this is specifically for a scheduled C-section recovery. I want to say that because if you went through labor and attempted the vaginal birth, I think your recovery would be slightly different than how I'm about to explain what it looks like if it's just a scheduled C-section. If you were pushing for many hours and then you had to get an emergency C-section, I think you would be more swollen and it would just probably look a little differently. So I just want to put that out there. Just so that there's no confusion on that end. I had a scheduled C-section, so this is just what my recovery looked like. Some tips and tricks that I want to give you guys on how to be prepared not only in the hospital, but to have your home prepared for when you come back home with your baby, and to have some things set in order and in place in your house that will just make the recovery process a lot easier. So with all that being said, let's just jump right into the video. Okay, so after the baby has been born, they're going to take you back into the room for the remainder of your time in the hospital for you to recover. Now, the spinal or the epidural, whichever one you got, it takes several hours for it to wear off. Like, I want to say anywhere between 6 to 12 hours is what you can expect for you to be completely numb and or just kind of slowly getting the sensation back into your legs and the lower half of your body. Now, I really recommend keeping those compression socks on that they're going to give you for as long as you can. They're going to require you to have them on at least for the first 6 to 8 hours so that the blood circulation keeps going in your legs. They don't want any blood clots. But I really felt like the compression socks also kind of helped wear off that anesthesia from the spinal faster. It just helped me feel like I was able to crunch my toes and kind of like wiggle my ankles and just keep getting the sensation back in my legs. So definitely keep the compression socks on as long as you can and really utilize them the whole time that you're in the hospital, because they really do just help that process speed up a little bit longer. So that's my first tip for you, is to use the compression socks throughout your entire stay at the hospital. The second tip that I have for you is once the spinal wears off completely, they're going to make you get out of bed and they want you to start walking around as soon as possible. And I really encourage you to do that. It is painful, but the sooner that you get out of bed, and you don't have to do long walks, like even if it's just walking to the restroom and back in your bed, just keep moving, because you don't want to stay in your bed and then get stiff. That's what you don't want. You really want to get out of the bed, even if it's just like sitting on the edge of the bed and hanging your legs over for a little bit and then laying back down, going to the restroom, just standing up and walking to the window and back. Just do little things like that every single day, because you really, like, the more you move, the quicker your body's gonna heal. And even though it's extremely painful, you really want to walk around. So I highly recommend you doing that. It's very important. The next tip that I have for you is to keep up on your meds and don't be afraid to ask for more if you need more. The nurses and doctors are, of course, extremely well when you're in the hospital at coming in and making sure that you're feeling okay and asking you if you need medication. But if for any reason they get distracted and they, don't come to your room on time, just call and ask for more meds, because if you wait too long, it's just not good. Like, you just want to keep up on those medications, and that way you're not ever feeling too much pain. So I was never afraid to call and be like, hey, I can start feeling it wearing off. I'm not in pain yet, but I don't want to get to that point. Can you please come to my room and get me more medication? And they were always like, yes, of course. And they were on top of it. So I really just, again, I encourage you just to don't wait too long for the meds to wear off. If you're starting to feel something, just call the doctor and have them come in and get more medication. The next thing is to drink a lot of water and to ask for a stool softener, because they're not going to let you leave the hospital until you have either had a bowel movement or passed gas. So I asked for a stool softener because you're so sore down in your lower stomach. The last thing you want to do is try to bear down to go to the bathroom. So just don't be afraid to ask for a stool softener and drink lots of water. That way, when the time comes for you to use the restroom for the first time after the C-section, that it's just easy. That's just what you want. You want it to be easy. My next piece of advice is that as soon as you feel like you are well enough to get out of your bed. What? I have my little man sitting down here eating, so I apologize. But as soon as you feel well enough to get out of your bed and walk to the bathroom, I encourage you to take a shower. It is such a big part of the mental process of healing. It just really it puts you in a different mindset, and it makes you feel so much better. So even though it's a little painful to try to step into the tub, but once you're in there and you take a shower, when you get out, trust me, you feel so much more refreshed, and you just kind of get like this boost of energy to make it through the rest of your hospital stay. So I encourage you that once you are allowed to take a shower, to do so. So while you're in the hospital waiting to be released, they will come in and continuously be checking your incision. And if you have a partner there with you or a significant other, I suggest that you have them come over and look at the incision when the nurse is there checking the incision, just so that they know what to look for, because when you get back home, you're gonna want to have that partner or significant other be continuously looking at your incision every day or every other day, and just making sure that nothing is looking out of the normal. So just so they know and can expect what to see, I would suggest for you to ask when the nurse comes in if they can come over and see what it looks like, so that they know what they're looking for when you go back home. So at this point in time, you're probably 2 to 3 days into your hospital stay. You're well enough to get out of your bed. You've been able to drink and eat food and use the restroom, take a shower. They're probably going to be prepping you for release to go back home. Now, you will bleed after having a C-section, so they're going to send you home with a whole care kit of different size pads, mesh underwear, a Puree bottle. So you're going to get everything really that you need from the hospital. Do not be afraid to ask for more, okay? If you think you need more, then ask them for more. But the Puree bottle is especially really nice because of the C-section. You will have had a catheter in, and it can be really sore down there once they take that catheter out. So when you use the restroom, it's really nice to have that Puree bottle full of warm water to just make that experience a little less painful. So they're going to send you home with that whole care kit. But something I do want to mention is that you should, before you even go in for your C-section, have a little station set up in your home restroom with just a few different size pads, because you may not bleed as much as you think. I mean, at least for me, like, I didn't bleed a whole lot. I know every person's experience is going to be different, but the hospital gives you like really big, hefty duty pads, and I just didn't need that many of those. So I was glad that when I got home, I had some ones that didn't feel like I was wearing a diaper. So just have a couple, like a variety at your house. That way you don't have to run down to the store or have somebody run down to the store for you. You just have it all set up and it's just there when you need it. Hi, honey. You good boy. So now that they've released you to go home, there are a few things I highly recommend that you do to get your home prepared for your release and when you get back to your house. The first thing that I recommend doing is getting your bed and your bedroom situated. And I recommend doing that before you even go in for your C-section. Have your pillows situated, have the pull-up crib that you're probably gonna have or want to get set up in your bedroom. In your bedside table, have some snacks and water, a place for all your medications that you're gonna have. Just get that area very cozy and comfy because you're gonna spend a couple of days just probably in your bedroom. Hi, buddy. So it's just best if you have that situated and it's one less thing that you have to worry about. But speaking of medication, this leads me to my next recommendation, which is there is an app, and I'll put a picture right here of what the app logo looks like. It's called Baby Time. And if you didn't watch my newborn essentials video, you should. I talk about that app and how it's extremely helpful because you have to keep track of your baby's like wet diapers and dirty diapers and feedings and all of these things. And it's an app that you can put all of that information in one place. But it's a very good app because they have a medications section. And for me, I mean, my baby wasn't on any medication when I took him home. So we just used that part of the app to track my medication because you're very tired. You're taking care of a newborn. There's a lot going on, and you have 2 or 3 different medications that you have to take after the C-section, and you have to alternate them. So it's really nice that you can use the app to set alarms, to track which one you took last, at what hour you took it. So I recommend downloading the app. It's for free, but trust me, it was such a lifesaver for me and my husband because I could never remember which medication I just took last. And you're going to be taking them for a while. So until you get on a schedule, I recommend using the app to track which medications you've taken last. It's going to be a lifesaver. Trust me on that. The next thing I want to say, and I know I've already mentioned this, was drinking a lot of water. I forgot to add, though, that you're going to want to purchase, it's called After Ease. I finished my bottle, but again, I'll insert a picture right here of what it looks like. You're going to have contractions after the C-section as your uterus is shrinking back to its normal size. And the After Ease, you just put a couple drops in your water. You're going to want to bring that with you to the hospital. Ask your doctor if it's okay if you start using it. I mean, I don't know why they would ever say no. It's very like organic and natural. And just start putting the drops in your water immediately and just start drinking it because it really helped. I want to say there's only 2 times that I actually felt hard contractions after. The rest of it, they were very manageable, and I really think it was because of those drops. They're really great, and the raves on Amazon are incredible. So I recommend you getting that. The bottle's only like $8, I think. So it's really an inexpensive tool to have to help with those contractions that you're going to have even when you come home from after being in a hospital. So make sure you get those and keep them next to your bedside so you can add some to your water. Something else to consider is buying non-scented soap for when you can take showers when you come home. You just don't want to be putting anything down on your incision that has scent or that's like, floofy. Like, you just want something simple, unscented that does the trick, because you're going to be really gentle when you cleanse that area. When you get out of the shower, you're just going to want to pat it dry. But you never want to leave your incision wet. You always want to have it be dry, and then again, have someone come look at it and make sure that nothing looks red and swollen, because if anything does look out of the normal, you need to get back into the hospital immediately, because you just do not want to mess with an infection down in that area. So get something to wash it that's really just plain Jane. So my very last piece of advice for you guys when it comes to a C-section recovery is to have somebody that you can rely on for help. You are not allowed to lift anything heavier than your baby for, I think, like 4 weeks after your C-section. So if you don't have someone that's living with you to help you out, I encourage you to ask a friend, ask a relative to come over on the daily and help you. Just do regular house stuff, because you're going to be taking care of a newborn. You're going to be taking care of yourself. There's just a lot going on, and it's so helpful to have a partner or a significant other or a family friend, just somebody to help you. I mean, do something as simple as fill up your water bottle. So I recommend that you kind of think of that ahead of time, just to, if you know you're going to be home alone, to have somebody come check on you, come help you out with simple things, because you're going to be very tired, you're going to be healing. It's it's just a lot going on. There's just like a time in your life where there's just a lot going on. So have someone there to help you is wonderful. And you can expect to not have a full recovery from a C-section for up to 8 weeks. So keep that in mind as well. The time frame that they give you is anywhere from 6 to 8 weeks. I felt like I was definitely like fully recovered more towards the 6 weeks. But there were a few things from time to time, like you will start to get little tingling sensations every now and then back where your incision is, just like nerves coming back, and it's a really weird feeling. It's not painful. I wouldn't say that. It's different, and you notice it, but you're not fully recovered until the 8-week mark. Another thing to keep in mind is that depending on your doctor, they're going to tell you that you can't drive for 6 to 8 weeks, which is such a long time. So again, it goes back to having somebody that you can rely on to come to your house or to go run errands for you, because you're going to have doctor's appointments, you're going to have checkups, and you can't drive to any of these things. So you really need to just to keep that in the back of your mind, so that you're not, flustered and trying to find rides to go to these doctor's appointments last minute, or go to the grocery store. So just have somebody, in the back of your mind that you can rely on to drive you around and get you from point A to point B. All right, you guys, so that is it for my video today on my C-section recovery tips and tricks, and just overall general timeline of what you can expect during your recovery. I hope that you found it useful. If you did, then please give this video a big thumbs up and consider subscribing to my channel. I will see you guys next time. Bye!